Guys, welcome back to the show. We're continuing our series in complete overall health, internal and external. Ms. Hima Dalal, the founder of Vital Energy, joins us this morning. And we're actually talking today about women's health, specifically the pelvis area.
Yes.
Let's talk about that.
So, women suffer with different problems throughout their lifespan. With the preteen, starting from preteen to childbearing age to the menopause. Our pelvic floor, the way it's made, it's the bone in between the two hips. The way it's born, this is how it is. It's a bowl that carries all the reproductive organs, and it goes through so many changes throughout their life. And that's why they carry, and plus they carry a lot of emotional pain. And
you carry emotional pain in your pelvis. Now, do guys do the same thing? I mean, I assume we got the same kind of bowl, right?
Right, but guys have a different hormone system than the women have.
Right.
And women carries most of their pain because they're so connected, right? Because they carry the baby, they go through all these menopausal changes, pre-teen changes. They carry most of their emotions there. Plus, we carry our fat there too. So all this visceral organ, when they go through the changes, it causes a lot of muscles and fascia and tissues, and the organs gets displaced. And that displacement causes so many women's health issues related not just to musculoskeletal problem, but also it causes the problems of the digestion, reproductive organ problems, endometriosis problem, also the way your uterus sits, and after having a baby sometimes it prolapses because the position changes.
Right. So say you've had a baby, or maybe you've had twins, triplets, and you've suffered from some trauma on the pelvic floor. What can you do?
So
and what do you do as a health professional?
Therapist, if you are trained to do myofascial release, you are trained to do manual therapy, you can help them create a space. Sometimes think about it, that you are 6 size and you are put in a 2 size clothes and say, go on for the rest of the 30 days, 40 days. What will happen? You will stop eating, you will stop breathing, you will feel pressure everywhere. So the physiological changes starts coming in.
Right.
And what therapists can do, relieve that pressure. Help them reposition those organs in the right place. Help them tone up their core right way. Piriformis is another muscle that is a sitting muscle that travels like this right in the middle of the gluteal area. And when your hip starts going in, your pelvic floor starts going in, it becomes you start walking like this, and you can't open your legs. And you can see how many problems can start.
So can yoga help with that?
Yoga can help, but you do need a trained therapist to release the fascia, to help you regenerate the muscle flexibility and pliability. And then you can, of course, continue with yoga and breathing and good routine exercises, drinking a lot of water, eating right.
An issue that many of you might not even be aware that you have.
Ms. Hima Dalal, Vital Energy, fascinating stuff. We'll put links for it at abccolumbia.com to Ms. Hima, some information as well as a segment if you want to hear some of this information. Great stuff as always, Ms. Hima.
Thank you so much.
Stay with us. We're coming back.